So today's lesson is to talk about breathing, the different types of breathing and respiration in general. The very first one that we are going to look at is the normal breathing. So we consider these axes to represent the amplitude of breath, whether you're having a deep or shallow breath, and this amplitude and this axis, the x-axis, to be the duration, whether you're breathing fast or slow. So this is the normal diagram or the graph to represent a normal breathing. This is how it looks like. So now let's look at when you're breathing very fast. This is how it looks like. The number of waves per minute are higher than usual. So this we call tachypnea. Tachy means fast. So tachypnea means a fast breath. And you can see how the waves are looking like. They're very close to each other. Now let's look at this. It's bradypnea. Brady means slow. Pnea means breathing. So this is slow respiration or slow breathing. So look at how the waves are very apart from each other. So that is bradypnea, meaning you're breathing very slow. Now, these are the changes when it comes to the time. Let's look at the changes for the amplitude. This is hyperapnea, meaning you are not E, but a Y, hyperapnea. It just means high breath. So normally they are talking about deep it's mainly about deep breath. So look at how the waves are. They are very high, the amplitude, meaning you're breathing in very hard and breathing out very hard as well. So that is hyperapnea. And then finally, let's look at apnea, what we normally see in if someone passes away. There is a straight line, meaning there is no breathing movement occurring. Now, as we understand this, now we're going to talk about things that confuse a lot of medical students. What we're going to talk about is about pathological breathing. Whenever we are talking about pathological breathing, so here is a diagram for us to compare it with the normal respiration. The very first pathological breathing we are going to talk about is our famous KUSSMAUL breathing. And this is how it looks like. I mean, from what we just said from the previous diagram, we could tell from here that KUSSMAUL breathing description would just be a hyperapnea plus a tachypnea. So the person is breathing very deep and very fast. Look at how the waves are very close to each other. So, and they are very high. So that is a hyperapnea plus a tachypnea. Normally we see this in patients of diabetes if they are undergoing a diabetic ketoacidosis. So during a diabetic ketoacidosis, there is too much acid in the body. So what the body tries to do is to do what? Expel the acid out. So the patient breathing very hard and very fast in an attempt to take out the carbon dioxide, which would reverse the acidity that has been created by the process in the body. Now, the next one that we would look at is this, BIOTS breathing. So the only difference between BIOTS and KUSSMAUL breathing is that with BIOTS breathing, there is a level of apnea in it. So you see a hyperapnea with the tachypnea together here. Here are the waves. And then after that, there is a short apnea, meaning there is a short stoppage of breathing. So you can see this graph, a hyperapnea with a tachypnea and an apnea. So the difference between KUSSMAUL and BIOTS is that BIOTS stops. So that is the mnemonic you can use to identify. BIOTS stops, whereas KUSSMAUL doesn't stop. The final one is CHEYNE-STOKES breathing. For CHEYNE-STOKES breathing, the main mnemonic I want you to have in your mind is a twisted chain. So it looks like a rise and then a fall and then an apnea. So the way we describe it is it's a gradual hyperapnea, a gradual hyperapnea, hypo meaning a decrease in the depth of breathing, and then there is an apnea. This normally happens in people who take intoxications of, whenever you are intoxicated with opioids and the others, normally the breathing that we see is CHEYNE-STOKES type of breathing. You can see the diagram, a rise a fall, and then an apnea. It's like a twisted chain or like a DNA, just that there is a short stop in it. Okay, let's look at some few keys when it comes to this whole thing. So chain stop breathing, what you need to remember about it, this is it, a gradual hyperapnea, a gradual after that followed by a gradual hyperapnea, and then an abrupt apnea, rise, fall, and then stop, rise, fall, and then stop. Next is the KUSSMAUL breath. And then for people that it normally affects are people that are under drug intoxication, especially opioids. However, people with hypoperfusion as well. So if the person, if there is less oxygen supply to the brain, they begin to have a chain stop breathing. What is the side effect of a chain stop breathing? You would get an acidosis because you are not able to expel enough oxygen, enough carbon dioxide out. So there is an acidosis created in the blood. The way we solve the chain stop breathing, what our body tries to do, normally it tries to induce a KUSSMAUL breathing. That is a continuous tachypneas with hyperapnea. So this is normally seen mainly in metabolic acidosis for people with diabetic disease. And we can also see it in people with renal diseases and the others, like kidney failures and the others. Normally, it is a process used to reduce the acidity of our body, the acidity inside the blood. The final one is BIOTS respiration. BIOTS stop, whereas KUSSMAUL doesn't stop. BIOTS, normally it has to do with neuronal damage. Maybe the person had a hand injury and the others, that is for BIOTS. Let's look at a quick question under this. The question to look at is, a comatose patient was taken to the hospital. He has a history of diabetes mellitus. Objectively, there is KUSSMAUL breathing, low blood pressure, acetone odor of breath. After the emergency treatment, the patient improved, the patient's condition improved. What drug has been administered to the patient? So here the key is that there is a KUSSMAUL breathing, meaning the person is undergoing a DK, a diabetic ketoacidosis, where the acetone smell. Together with this, you normally have to give the patient insulin. So our right answer here is insulin. They are asking what treatment was given to make the patient feel better. So that is it. Thank you very much. Subscribe to our channel for more videos.